Well, getting back to that incident yesterday, coupled with a mass shooting at the Navy Yard just last month, it's once again opening up discussion of mental health in our country. There's legislation on Capitol Hill which would strengthen community mental health services. WENY Washington correspondent Ted Fioraliso caught up with the bill's sponsor to see how it might have helped these two suspects before it was too late.
It's been almost 3 weeks since Aaron Alexis went on a shooting rampage at the Washington Navy Yard, killing 12 innocent people. The FBI says Alexis believed he was being controlled by electromagnetic waves. Then, just yesterday, Miriam Carey was shot and killed by police after she led them on a car chase from the White House to the Capitol building. Police say Carey used her car as a weapon, striking a Secret Service officer. Today, CNN is reporting investigators found 2 medications in Carey's apartment, one used to treat schizophrenia, the other an antidepressant.
We have so many gaps in the system right now.
Michigan Senator Debbie Stabenow is the sponsor of the Excellence in Mental Health Act. It would improve quality standards at mental health centers, helping to expand access for people with mental illness.
If we had our bipartisan bill in place, there would be a 24-hour psychiatric emergency facility where the police could take someone who needed help, or the family could go, or the individual themselves, and there would be people that would know what to do and would be able to begin to treat that person.
I spoke to Stabenow earlier this week, before the incident at the Capitol, but after the Navy Yard shooting. She says the majority of people who have a mental illness are not dangerous and are more likely to be the victim of a crime than the perpetrator.
The truth of the matter is, when something happens like this, too often you can look back and see the connection that they didn't get the help that they needed.
Right now, the Excellence in Mental Health bill is still in committee. Stabenow says she's working with her colleagues on both sides of the aisle in the House and the Senate. One possibility is to include it in a larger health bill later this year.
I don't care how we do it. Families, individuals, law enforcement, potential victims of crime are waiting for us to get this done.
In Washington, I'm Ted Fioraliso.
Stabenow also authored an amendment in the Affordable Care Act that ensures mental health is treated the same way as physical health.